Hey Heather,
Hi.
how's it going?
Going okay?
You doing okay?
Mm-hmm.
I'm Kevin. I'm a student therapist. I'm working under Dr. Clausen.
Okay.
I'll be helping with you today.
Okay.
We understand you have some neck pain.
Mm-hmm.
Yeah? How is it feeling? What's going on?
Well, I went to the doctor the other day and got an MRI done,
Mm-hmm.
and they said that I had degenerative joint disease. I think that's right.
Okay.
I don't know. It just kind of sounded really scary, and it feels like my neck's like falling apart right now. And it just hurts to move it like any direction.
Okay. Yeah. And moving it hurts. What about touching around it, or does that hurt as well?
Yeah. Even just like trying to like lay down in bed, like the pillow on it will hurt.
Really?
Yeah.
Okay. So yeah, I took a look at those MRI results that you mentioned, and that is what the doctor said: degenerative joint disease, right?
Mm-hmm.
That sounds pretty scary.
Yeah.
Right? The word degenerative. None of us like hearing that.
Yeah.
I will say, a lot of times radiologists will see things and they have to put a title to it.
Okay.
No matter how severe or not it is. And sometimes people can have this label without very severe damage done to their spine. Okay. But that doesn't mean they're not feeling pain.
Okay.
And so you can have somebody with a really pristine, beautiful looking spine,
Mm-hmm.
neck, that has a lot of pain.
Mm-hmm.
And we can find people that have really ugly looking necks, and they have no pain. And so I tell you this just so that you know that even though there is a little bit of variation, or not variation, but a little bit of damage in your neck, it's not going to be miserable for the rest of your life.
Okay.
And we're going to get you stronger, and you're going to be able to overcome this pain that you're feeling. Okay. So I want to start by discussing that pain. What is your understanding about what nerves are and what they do?
I don't know. I just know that they're all over your body. I don't really know anything else, though.
Okay, yeah. You're right. They are all over your body. They're everywhere. Mm-hmm. And they help us with movement and with sensing touch and pain and, even our vision and smell and things like that. Okay. And so what happens when we feel pain is that our nerves will send information up to our brain, and our brain is going to interpret that as pain. Okay? So what I think what happens, well, let me start here. Our normal nerves, the normal signals they send are about like this level, right? Mm-hmm. But when we experience pain and they're sending us to the brain like something's going on over here, their activity comes up here and they're really active, right? What do you think would normally happen though as we get better? Like say after I rolled my ankle.
Probably go down.
They go down, yeah. As we heal, usually they go down.
Okay.
But for some people, for whatever reason, they don't really go down. They stay up here. They may go down a little, but even the slightest touch or, movement will send that message back up, and that pain is always present. Mm-hmm. And so what we have is oversensitive nerves. Okay. And that is a big reason why we continue to experience pain even after our accidents and things like that. Okay. And so if you can imagine it, have you ever been in a house with an overactive smoke alarm?
Mm-hmm.
Yeah? Like you just barely started cooking, I don't know, like the eggs, and the steam sets off the smoke alarm, right?
Yeah.
Even though it's just eggs. And they're just scrambled and they're going to be good, right? Mm-hmm. Yeah. That's kind of what we're looking at here with oversensitive nerves.
Okay.
They're sending off signals even though not that much, like a touch, not that much activity is being done. Okay, does that make sense?
Yeah.
And so there are other things that can influence why our nerves are extra sensitive. I know you've mentioned that you're having some financial struggles, and your grandma's not doing too well right now. Those are pretty stressful things, right?
Yeah.
Those stressors can contribute to our pain that we feel and can exaggerate our pain.
Okay.
And so, along with our physical therapy treatments like exercises and different techniques we'll use, we want to try to help you resolve some of those things, or at least make them less stressful.
Okay.
We do have resources to help you do that. Is that something you'd be interested in?
Definitely.
Okay, awesome. We're going to look into that for you. And in all of these things, it's like a juggling act of all these things that contribute to pain. We're just going to try to de-stress a lot of these and get these sensitive nerves you have to calm down.
Okay.
Is that okay?
Mm-hmm.
And we're going to make sure your neck's strong and that you can continue in your normal life without feeling this pain all the time.
Okay.
Does that sound good to you?
Yeah, sounds really good.
Okay, let's do it.
Thank you.